exam. Obviously, you will get 9 minutes to prepare for this station. Begin, please. Reading. Right, so if you've read and understood, considering it communication skills station, kindly please begin.
Hello, I am Dr. Mahmood,
Okay.
one of the surgical trainee working for Mr. Mann. Can I
Hello.
confirm I'm talking to the vascular consultant?
Hello. Yes. Yes, you are.
Okay,
Can you
Please go
summarize
on.
your case?
okay.
Tell me
So I
what's
have a,
what the case is about.
okay, doctor, I have a 54 years old lady who came to
Yeah.
us with the primary diagnosis of diverticulitis, but that symptom is improving with conservative treatment. But now the main complaint, the patient having a sudden acute right lower limb pain, and that pain is like out of proportion. So we did
Okay.
an ECG, which is shows atrial fibrillation and some preventricular complex. And we did a arterial Doppler ultrasound, which shows acute limb ischemia. We did also ABG, which showing metabolic acidosis and hypokalemia. So I think the patient will be benefited by you. So we want to
Okay.
transfer the patient for your special care.
Uh, okay. So, do you think it's urgent, or or you can send it tomorrow?
No, I think it's urgent because the patient is having a acute limb ischemia. So I am worried of if we cannot intervene the patient urgently, she might lose the limb.
Okay. So you told me that the case has ventricular arrhythmia, or what is it
Yes, the
exactly?
patient, we did an ECG which shows atrial fibrillation and preventricular complex.
Okay.
So
So,
for that one, I
do you
think we can start treatment for that one, if you permit. And then maybe after being transferred to your facility, the patient can be seen by a cardiologist.
Okay, I think it's better to be that should be dealt with by a cardiologist. It should be seen by a cardiologist, I think, before sending the case to me with to treat the atrial fibrillation and the ventricular arrhythmia, as you told me, right?
Yes, sir. So maybe it's due to the electrolyte imbalance. So we can start treatment, of course. We can give fluid and then we can start treatment for atrial fibrillation. And then, as the patient now main concern is acute limb ischemia, so we can transfer the patient and then cardiologist review it can be done from there.
Okay. So what what do you think is the diagnosis?
So, okay, she came to us as a primary diagnosis of diverticulitis, but now the abdomen is flat, soft, non-tender. We started antibiotic, IV fluid, though she might have a mesenteric ischemia due to this mild abdominal pain, but we are mainly concerned about the lower limb ischemia.
So do you think it's diverticulitis or do you think it's something else?
It could be a mesenteric ischemia, but we
Mesenteric
need to do a
embolus.
or an embolus, yes. So we need to do a CT
Mhm.
angiogram to confirm the diagnosis. So that one I think can be done after being transferred.
Okay, so I think you need to scan the abdomen first and then send the case, right? To make sure what the diagnosis is exactly.
Okay, so yeah, we can do that way, but I think as there is a fear of losing the limb, so we can do it
Mhm.
after transfer.
So you think it's not that serious now
No,
to
as the
to
abdomen
scan the
is
abdomen?
soft, non-tender, so
Mhm.
I will do serial abdominal examination, and maybe we can prepare for a CT scan abdomen with contrast if the renal function is normal,
Good.
and that one should be done after transfer.
Okay, so what do you think? Which imaging should be used? Mm,
We can do a CT abdomen angiogram, CT angiogram.
mhm. And what treatment do you prefer?
Sorry?
Which treatment do you prefer
Okay,
if
so
if
we
if you find it to be an ischemia, or as you said, this is emboli?
okay, so if it's an emboli, we can try with anticoagulant, but the definite
Like
treatment
what?
should, yes, but the definite treatment should be unfractionated heparin,
Mm-hmm.
like 5,000 unit bolas we can give until the APTT is 50 to 16 seconds. And then for definitive treatment, we can do embolectomy
Okay, embolectomy of
or
where?
uh, of uh, of the ischemia of the limb. This, or maybe we can do thrombolysis as well, or we can do bypass
Mhm.
operation.
Okay, can you tell me which bypass? Do you have an idea?
Uh, yeah, we can do maybe a, a femoral bypass. It depends on the level of the obstruction.
Embolus. And
Yeah.
okay, okay. So, can you give me a summary of the management plan? What's your management now
Okay,
before
so
transferring the case?
we
What will
have
you
to
do for the
correct the
case now?
electrolyte imbalance as the
Mm,
patient is having hypokalemia. Then we have to
good.
correct the atrial fibrillation with
Okay.
anticoagulation, and then we have to correct the metabolic acidosis by fluid, and if necessary, we can give sodium bicarbonate. And then we have to arrange a ICU bed for the patient for cardioversion, and, then maybe
Okay.
we
What do you
have
like
to
to
check
have in the
blood results.
ambulance while you transfer the patient?
So the patient might have CPR kit, then
Okay.
oxygen, and
Blue light
for
ambulance.
is blue light ambulance, and maybe a
Mhm.
cardioversion
Okay, that's
bed
good.
also should be there.
Do you need to talk to the family?
Yes, we have to talk to the family about the disease and about the prognosis. Patient might lose the limb. Patient might have developed. Of course, he has a uh, critical limb ischemia, so patient need operation urgently. So if it's success, it's fine. If not, then patient might lose the limb as well. So we need amputation.
Okay, good. Okay, I think you can transfer the case
Good.
Okay, thank you, sir.
after
Yeah.
you do all this management plans, and you can transfer the patient.
Good.
Okay,
Time
Okay,
goes
sir.
over as
Thank you.
well.
thank you.
Very good. Excellent.
Thank you.